Hello, my name is David Hamilton. I'd like to speak to you briefly today about the profession of respiratory therapy. I'll be speaking to a few basic points such as your educational requirements, licensing requirements, and areas of employment. But first I'd like to share just a little bit about myself and my background. I've been a licensed respiratory therapist for about 14 years. I obtained my associate's degree in 1997, and in 2011 I obtained my bachelor's degree. I've worked in hospitals and home care settings, but the majority of my experience comes from home care, in which I travel to patients' homes to care for and treat them. Let's start with educational requirements. To be a respiratory therapist, you need at least an associate's degree, which can be completed in 2 years. Although an associate's degree is the minimum educational requirement, you can pursue your education further by obtaining your bachelor's degree. Although it would require an additional 2 years to get your bachelor's degree, most employers look favorably on those who have more education. Most colleges, universities, and technical institutions offer training to become a respiratory therapist. For those of you who are interested in or might be interested in respiratory therapy as a career and plan on applying to a program after high school, you should focus your studies on subjects like health, science, biology, and math. College-level courses in respiratory therapy would include anatomy and physiology, microbiology, mathematics, and pharmacology. In addition to traditional classroom instruction, all programs offer supervised hands-on experience, which is usually referred to as your clinical rotations, in which you would be treating and caring for patients. In my opinion, the clinical rotations were the best part of the education, as they expose you to as many different experiences as possible. This training usually and most often occurs in the hospital setting. Just to give you an example of what your clinical experiences might be, when I was going through school, I was doing a rotation through the neonatal intensive care unit and the pediatric intensive care unit at a bigger metropolitan hospital. I was being supervised by the lead therapist at that time that was assigned to the NICU, PICU, and the emergency room only. That's not normally the case to be assigned to one area, but being in a bigger hospital, you have more therapists on staff. The one instance in that clinical rotation that stuck out to me and made an impact was I was caring for a set of twins who were born prematurely with severe cardiac issues and other health problems. You get attached to your patients sometimes, so one of the twins that I was caring for died, so that was one of my first clinical experiences, if you will, is dealing directly with, with death, and that is part of being a healthcare professional. Moving on to your licensing requirements, your credentialing requirements. All states require practicing therapists to be licensed in order to provide patient care. In order for you to obtain your respiratory license or credential, you must have graduated from an accredited respiratory therapy program, and you must pass a credentialing test. The National Board for Respiratory Care, or the NBRC, is the governing entity for respiratory therapists. The NBRC provides for 2 levels of credentialing, the first level being the Certified Respiratory Therapist Credential, or CRT. The second level of credentialing, and the most preferred credential for potential employees, is the Registered Respiratory Therapist credential. Each credential requires you to take and pass an exam, and there is an order in which the exams must be taken and completed. You have to pass the CRT examination in order to be able to take the RRT examination. The RRT credential requires that you take a two-part test. One test is a multiple choice test, and the second part of the test requires you to navigate through a series of several different simulations in which you have to choose the correct treatment for a particular disease process, or the best option, the best treatment for the patient. So that is, those are your educational requirements, or degree in respiratory therapy. Potential areas of employment would be primarily the hospital. Hospital's a pretty broad area, so you have to be pretty knowledgeable about nursing concepts, measurements and values that deal with blood pressures, heart rate, pulse. You could be in a bigger hospital, perhaps dedicated to an OBGYN floor, to where you assist in all the deliveries as a respiratory therapist. You could be dedicated to the emergency room, where all you do is handle emergent cases coming through the emergency room. As a respiratory therapist working at a home medical equipment store, durable medical equipment, I provide care to patients who are in their home. Recently we had a pediatric patient discharged from a local hospital that was going home and required intensive home therapy. She required a ventilator, apnea monitors, feeding pumps. It was a month in the process of getting the patient home, finding out what their needs were going to be, helping mom and dad, doing a home evaluation, making sure that the electrical requirements for the equipment, the respiratory equipment that they were going to need, were sufficient enough to power all the equipment. Just finding out what the parents' needs were going to be. A week prior to the baby's discharge, myself and the other therapists that I work with actually went to the hospital. Spent about 3 hours educating mom and dad on how to use the equipment, the alarms associated with the equipment, how to correct any type of alarms. So it was a very lengthy process. From the time that we got the referral from the hospital to the time that the baby actually arrived home was just a little over a month. Why should you consider respiratory therapy? The most rewarding part of being a respiratory therapist is just getting to know people. If you care for them over an extended period of time, or for any amount of time for that matter, you want to establish that personal connection between the two so that they trust you and understand that you know what you're doing and you know what you're talking about and you know how to care for them. So you establish those relationships, and then it goes beyond the caregiver-patient relationship and it becomes a little bit more personal. The skills that you develop in your clinical rotations, in my opinion, count more towards building that level of trust between the patient and the therapist. You also have to be able to work with the physicians, especially keep an open line between yourself and the nurse and that patient's physician. It's important to stay on top of new orders that come through for the patient. The nurse will most times communicate to you, hey, we have new orders. The patient's treatment has gone from every 4 hours. Now the doctor wants the treatment to be every 2 hours because maybe the patient's condition has worsened. So you have to be able to establish those communication, those relationships. Pulmonary rehabilitation is a disease management skills. It teaches that patient how to manage their daily activities. You're not going to reverse the disease, you're not going to make the disease any better, but you're teaching them healthy eating habits, what foods to avoid because you have a certain pulmonary condition. You're teaching them certain breathing techniques that help them to breathe easier and deeper. You're teaching them how to, exercise, how small incremental steps in their exercise program can increase their stamina and their energy levels. They even go so far as to teach them how to walk up and down stairs to eliminate, just that loss of breath and quick fatigue. You definitely need to a character traits that are good for therapists is and for any healthcare worker, as far as that go, any healthcare professional, is a sense of humor, because it can be a little heavy sometimes, but as long as you have a sense of humor, you can usually deal with just about anything. You have to be compassionate, and you have to realize that these patients are sick and they are vulnerable, and they're frightened, and they need someone there that can assist them and reassure them that you're taking good care of them. Not all your days are going to be good days, and that's just how it is. Everybody has days where things just don't go right. But then there are those days where you can, even if it's just putting a mom or dad's mind at ease, or it's putting an elderly lady's mind at ease by just sitting with it and talking with her. It didn't have to be about anything, but just being able to make someone smile or take their mind off of whatever it is that they're going through at that time, then yeah, you definitely make a difference. Again, my name is David Hamilton. Thank you for the opportunity to visit with you briefly about respiratory therapy. Uh, uh, I knew what you meant. So good.
We'll do a bloopers reel after.
Exactly.